Hello, my name is Dana Henry.
Hi, Dana.
Nice to meet you.
Nice to meet you.
I'm going to be your nurse practitioner student today.
Okay.
They've asked me to come and talk to you a little bit about your health history, and then we'll discuss what you came in for today, if that's okay.
Okay, sounds good.
All right, can you start off by telling me your name?
Brian Ainsworth.
Okay. And what's your date of birth?
12/7/85.
And how would you like to be addressed?
Brian's fine.
Okay, Brian, are you currently employed?
No, I'm not. I'm a student.
Okay, and what are you in school for?
Nursing.
Nursing school. That's wonderful. Congratulations.
Thank you.
All right. And so can you tell me a little bit about what you came to the clinic for today?
I've had a really bad sore throat, and it's just kind of getting worse and worse.
Okay. And when did this sore throat start?
About a week ago, I just kind of woke up one morning, and it was hurting, kind of tickly,
Okay.
and it's just kind of gotten worse.
Okay. So have you ever had any relief from it this week at all?
No, not really.
Just a constant sore throat for about a week now?
Yeah.
Okay. And does the discomfort, does it radiate to any other area?
No, it doesn't radiate. It's just a constant kind of hurt.
Okay. And is there anything that makes it worse?
Swallowing makes it worse.
Okay. And with that, have you been able to eat and drink food and water okay?
I mean, yeah, I'm staying, my nutrition is fine as far as that goes. It just hurts whenever I eat and drink.
So you don't cough or anything when you're eating or drinking? Okay. And what about, do you have a cough at all or any nasal drainage? Headache?
No, not really. The only other symptom really is I've been real fatigued, tired, and, I just figured it's just from being up because it hurts and I'm a student, so.
Okay. So you've been fatigued also. It sounds like your voice is a little bit hoarse. Is that new for you?
Yeah, just the last couple days I've noticed it's really gotten kind of bad.
Okay. Has anything made any of this better for you?
No, I really just tried some Tylenol just to make it better, and it didn't really help.
Okay. Have you had any exposure to tobacco smoke?
No.
You're not a smoker yourself, or no one in the home is? What about any chemical irritants or allergens?
No, not that I know of.
Is anyone in your home sick?
No.
Have you been around any illness lately?
No.
Okay. What about any nausea, vomiting, reflux?
No, none of
Anything
that.
like that? And let's see. Okay. I think if it's okay, we'll talk a little bit about your past medical history. That's going to include your childhood and your adulthood. So with your childhood, did you have any illnesses?
Just chicken pox. I had the chicken pox.
Okay. And any rheumatic fever or other childhood illnesses?
No,
chronic illnesses as a child? Okay. Did you receive all of your immunizations?
Mm-hmm.
And those are still up to date?
Yes.
Okay. And as an adult, have you received any diagnosis of any medical conditions?
I've had a little bit, a few things. Hypothyroidism.
Okay.
And hypertension. And obesity. And with that obesity, kind of played into, I guess, arthritis. With that.
And where's the arthritis?
In my knee, my right knee.
In the right knee? Okay. Yeah. Alright. And let's see. Have you had any previous surgeries?
I've had a few. I had the gastric sleeve surgery done to help with the obesity. And it's been pretty good. I've lost 150 pounds.
Oh, congratulations.
Yeah, thank you. And I've also had 3 scopes on my knee done.
Okay. On that right knee only?
Yes.
Okay. And what were those scopes done for? What kind of injuries have you had?
tore my meniscus and my MCL, my right knee.
Okay.
But I've also had a couple other things. My wrist, I broke my wrist and my kneecap a couple years ago. So I'm sure that has something to do with it too.
Okay. Let's see. Are you allergic to any medications?
No,
Okay. No allergies. Do you have any food allergies or environmental allergies?
no, I do not.
And I saw something about NSAIDs. Is that not an accurate allergy for you?
Yeah, I guess they told whenever I had my surgery that it can irritate my stomach and give me an ulcer. So I guess I am allergic to NSAIDs, so I'm not supposed to take those.
No reaction. It's just for prevention.
Yeah.
Okay. All right. And you said you have hypothyroidism. Do you take medication for that?
I do. Once a day, I take levothyroxine.
Okay. Are there any other medications that you're taking?
Yes, I take a multivitamin every day and Nexium to keep the acid from going all crazy.
Okay.
I take calcium and B12 once a week.
Okay. The B12, was that prescribed to you?
Yes. I had a B12 deficiency, and so they want to make sure I get that once a week. So.
Okay. That looks good. Have you had any hospitalizations?
Yes. After my sleeve surgery, my gastric sleeve surgery, I was in for 2 days.
Okay. But besides that, no other?
Nope.
Very good. And have you ever received any blood transfusions?
No, I've not.
As far as screening tests go, have you had any recent blood work that's monitored your cholesterol or anything like that with your bariatric surgery?
Yeah, they've done all the CBC, cholesterol, all that good stuff, glucose and all that.
Lab work.
Lots of lab work.
Okay. And let's see, have you had a recent eye exam or dental exam?
Yeah, I just went in for a dental exam. Eye exam was probably a year ago.
Okay.
I've had a TB skin test for school recently.
Oh, okay.
And I just recently, and I had to get also the flu mist and a hepatitis B series.
Okay. And that was just this past year?
Yeah, just in the last few months.
Okay. All right. If it's okay, I'd like to talk to you about your family history a little bit. Can you tell me a little about your mother and father?
My mom's got hypothyroidism also.
Okay.
My dad has high blood pressure. He's kind of crazy. He's got arthritis and lots of broken bones in his past also. But other than that, they're both fairly healthy, very healthy.
Okay. How old are your parents?
They're both 50.
All right. And do you have any siblings?
I have a sister. She's 27.
Okay. And does she have any health conditions?
Not really that I know of. She's overweight though. I don't know technically if she's obese or whatever, but.
Okay. And your grandparents, are your grandparents still alive?
All but my grandfather on my mom's side.
Okay.
He was killed in an accident when she was a kid, actually.
Oh, sorry to hear that. Your grandparents that are living on your mother's side, that would be your maternal grandmother?
Yep.
How old is she?
She's 80.
Okay.
She's lived a long, full life.
And does she have any medical conditions?
Yeah, she actually is battling cancer right now in her pancreas. So.
Sorry about that. Does she have any other medical conditions that you're aware of?
She's hyperthyroid.
Oh, okay. And then on your father's side, his mom, how old is she?
66, 65,
Okay.
somewhere around there.
And does she have any health problems?
She's got diabetes, hypertension, arthritis. Um, that's all really I know.
And then what about your grandfather on that side?
He's got some severe back issues. Lots of back pain, I guess. But I don't really know a whole lot more about him.
Okay. Do you know his age by chance?
66, 67,
Okay.
somewhere around there.
That's good. Thank you for that information. Would you be able to tell me a little more about your social history, where you were born, where you grew up, a little about your highest level of education that you've received?
Sure. I was born in Houston and lived there for a few years. I guess then we moved up to Central Texas, went to school, Brusco Eddy, around here. Graduated in '04 and then went to college at UMHB. Graduated in 2009 with a BS in history. Went on and got my teaching certificate. Was a teacher for about 4 years.
Okay.
Met my wife there, and we got married in '08. And now, the last couple years, got laid off from my last job teaching and decided it was time to make a change. And so got back into school, and here we go. Got one last semester.
Congratulations.
Thank you.
That's awesome. That's a lot of accomplishments.
We have, me and my wife have a 2-year-old now, too.
Oh, okay. A boy or girl?
A girl.
What year was she born?
She was born in 2012.
Okay. Do you want to have any more children?
Yes.
You do?
Yes.
What about, do you have any cultural practices that I should be aware of?
Not that I know of.
Okay. And I guess going back, you were talking about your weight loss and everything, how you've lost 150 pounds. How exactly have you done that? Are you doing any special diet or exercise?
Yeah, I eat lots of protein, not eating fast foods, all that, not drinking sodas. I exercise, try and exercise at least 4 days a week.
That's very good.
Try and do more if I can, but the knees and stuff, it kind of hurts. But at least 30 minutes a day, try and get an hour if I can.
Okay, that's really good. You said you're a non-smoker. Do you drink any alcohol?
Not anymore, no.
Okay. And any illicit drug use?
No.
In your home, do you have any safety concerns?
No.
Okay. And what are your living conditions at home?
My wife and I and our daughter, we live in just a 2-story home. It's in a good neighborhood. It's a pretty new construction, about 2-3 years old.
Okay.
So it's just nice big house.
Now, I wanted to move on to a psychological history. So just ask you how, in general, how you're feeling, how your mood is. Are you having any thoughts of suicide or homicide,
No.
depression,
Oh no.
anxiety?
Just what comes along with school.
Yes, I understand that. And so with school, with the stress and anxiety, how do you cope with that?
I like to cook. Me and a buddy, we have a barbecue competition team that we cook.
Okay.
Exercise, like going to sports, doing things like that.
Very good. Sounds like you have a pretty good support system.
Yeah, my family's great. My wife is very understanding and very supportive. So.
Do you have any spiritual concerns or special practices, preference for any certain denomination?
Well, I'm Christian. Baptist, and I actually just finished up in December of last year, actually, a discipleship program. So I'm actually a minister.
Oh, okay.
So, but other than that, nothing crazy or special.
Okay. One of the last things to go over here is your sexual history. So just wanted to talk to you a little bit about sexual partners, number of sexual partners, if you've had any history of any sexually transmitted diseases or anything like that.
Nope. No. Just one sexual partner, my wife. Just no STDs or anything like that. So.
And you said you did want to have another child. Are you currently trying, or are you doing anything to prevent pregnancy?
No, we are kind of trying, I guess, to have another kid.
All right, very good. Okay, so just a couple questions. Wanted to ask you as far as your health is going right now. So you said you don't have any nasal discharge or headache, anything like that. What about any fever lately or chills? No? Any night sweats or unexpected weight changes that you haven't been trying for?
No.
And you did say that you did have fatigue and maybe a little trouble sleeping?
Yes, for sure.
Have you had any changes in your skin, any hair changes, mold changes with your nails, any thickening or color changes, anything like that?
No.
No changes in your hair texture, hair loss? Okay. Any head injuries?
No.
Dizziness or loss of consciousness? Okay. You said you had your eyes checked. Do you normally wear glasses or contact lenses?
No, I don't have any vision issues.
Okay. So no blurred vision lately, double vision, no trauma to your eye or eye disorders or diseases?
Nope.
Okay. Have you had any ringing in your ears, any ear pain, discharge, hearing loss?
No.
Vertigo?
Mm-hmm.
So you said no nasal drainage. Have you had any postnasal drip or sinus congestion, pressure, pain?
No, not that I know of.
I know you have a sore throat, a little hoarseness in your throat, and your voice. You said it's worse when you swallow. Do you have any problems with your dentition, bleeding gums, ulcers in your mouth? Anything else going on?
No.
So just the sore throat, the hoarseness, and a little increased pain with swallowing.
Yes.
Okay. What about any stiffness in your neck? Any lumps in your neck, lymph nodes that might be swollen, masses? Haven't noticed anything like that?
No.
Okay. All right. And the breast, do you have any pain or tenderness, any masses? Nothing like that? Okay.
Nope.
And you said you didn't have any trouble breathing and you haven't had a cough, so no sputum, no sleep apnea, no shortness of breath.
Nope.
And then cardiovascular wise, have you noticed any palpitations, chest pain or discomfort, any swelling, edema anywhere?
No.
Okay. You said you've been eating fine, no nausea or vomiting. What about your bowels, any diarrhea or constipation?
No.
No bowel changes? Indigestion or heartburn, no rectal bleeding, pain in your abdomen? Have you been urinating without difficulty?
Mm-hmm.
No burning?
Nope, no issues.
Bleeding, no dribbling or incontinence? Okay. Any testicular pain or penile lesions?
No.
And as far as your legs, I haven't noticed any, but do you have any changes in the color of your extremities?
No.
Okay. I have that you've got your right knee pain. Do you have any other joint pain, muscle pain, swelling, trauma, weakness in your extremities?
No.
Okay.
Just the knee.
You said no feelings of depression or anxiety?
No.
Okay. No thoughts of suicide or homicide?
No.
Are you experiencing any numbness or weakness?
No.
You haven't had any fainting or loss of coordination? Okay. Have you noticed any bruising that, like you're bruising easily, or do you have any bleeding tendencies?
No.
I know that you said you have hypothyroidism. Have you noticed any tenderness in the thyroid in your neck here?
Not that I've noticed.
No excessive.
Just from the sore throat, I guess.
Just sore, but not any tenderness outside, just from the inside. Okay. And have you had any intolerance to cold or heat, hot or cold temperatures?
No, not any more than normal.
Okay. When you say not more than normal, what do you mean by that?
Just being, sometimes I run hot, I guess. I'm hot-natured.
Okay.
So again, they've always told me that was just because of my thyroidism.
Oh, okay. Have you had any excessive thirst or urination, hunger? Nothing excessive. Okay. That looks good. I thank you for providing information with all that. I know that's a lot to go through there. Thank you for giving us a detailed history.
No problem.
Well, it was very nice to meet you. I'm going to go review this with the doctor, and then we'll be in shortly to see you, okay?
Okay, sounds good. Thank you.
See you in a minute.